And I think it's just about time to start. So if you'd like to host this time, or I can do the first couple minutes of introduction if you want, Harry.
Yeah, go ahead. Yeah, go ahead, Chris, and I'll just come in.
Great. Hello, welcome everyone to the online MOOCs for learning AMR screening and theory. This is the fifth and final online lecture of the series before we go on to local workshops. And this is hosted by Harry Rico, and he's going to be talking about digital mapping and his new app that he's invented, MicroBis. And he's going to be talking about how we can use this to track AMR, which is really, really cool. As with all the previous lectures, you can find us, next slide. You can find us hosted online on the AMR MOOC Africa Challenge. And you can find all, so if you've missed a recording, you can find all the recordings here, as well as the slides for every session. And a few people did miss one or two, but managed to attend quite a few. And so later I'll be sending a form to catch anyone who was part of that group, didn't manage to get to see them all, but saw most of them. And saw maybe even asynchronously online later. So far we've talked about microbiology and bacteriology, the first MOOC, 21st September. And the second MOOC, we talked about the techniques involved in the identification of microbes with Linda. And then the third MOOC on sensitivity testing. And then last week we had AMR stewardship with Gamli and Beverly. And this week we have the digital mapping and MicroBis. And then later on we'll have the local workshops. And so today we've got Harry. This is the rest of the team, if you've forgotten already. The next slide. We've had so far Courage, Professor Courage Saba, Dr. Linda Salekwa, Gamli, Joy, who's always here in the chat, so say hello. Today we've got Harry. We've had John Moat before, myself and Beverly, but Harry is going to be the one talking today. He's the founder and inventor of MicroBis. So take it away.
Thank you very much, Chris. I'm personally excited that we are here today to continue the conversations around antimicrobial resistance. I mean, we've had presentations on, the biology of bacteria, subsequently moving on to how we can identify them. And then today, we want to look at a different angle to which we can identify bacteria using digital technology and also other technologies that, have been evolving for the past decades. Unfortunately, we haven't seen much of that in health, but today I have been working with some amazing team and of course the team here to see how we can leverage digital technologies for helping fight antimicrobial resistance. Today, as part of my duties for today, I'm supposed to take us through digital mapping using our novel digital platform, which we have built and we call MicroBis.io, which is a Ghanaian app for isolating or identifying isolates implicated in infection and disease, and also how it could be used for antimicrobial resistance tracking. So, as part of the engagement today with you, I will talk about what digital mapping is and why it is important. What kind of data do we see? Most importantly, we'll be talking about what biomedical data is and what its relevance is, and tying it into how it can be used for digital mapping, and also what we are talking about, MicroBis, how it could be used. Then from there, we will then do a quick demo of MicroBis and then play around with it in some group. We'll be forming a group to do and engage in a quick datathon. And we will then look at another version of MicroBis, which is supposed to bring all the data we are accumulating over the course of using MicroBis.io and visualizing it. And that's, I think it's one of the important parts of what we are doing to communicate, most importantly, the public health emergency of antimicrobial resistance. So that would happen when we get there. And just finally wrap up the my lecture with an open discussion on what we think we can do to improve MicroBis towards helping largely clamp down the challenges of antimicrobial resistance. Yeah, so a quick one, like I mentioned, we're going to look at what digital mapping is. I picked a quick definition from Sage Research, and we'll then look at what it is. So digital mapping, according to Sage, is defined as digital mapping concerns the art and science of using digital technologies to deal with spatial data. Now, I think one of the important things to just pay attention to in the first statement is digital technologies. Several digital technologies exist. We have them being used across the internet, and I think most of you who use, I mean, just the computer, you may have seen quite a number of them. You have the web technologies, we have the mobile technologies. Anything that is translating some form of data in a digital format or anything that is enabling that to be done is what we call digital technologies. Now, in the definition, there is this word that came up, deal with. Usually that equates to the processes that enhance the mediation, or that mediates the process of collecting data, transforming them, making them clean, and finally combining them with geospatial data. Now, one other thing to just bear in mind when we are talking about digital data, where we see, I mean, recurring words like digital technology and finally geospatial data, is that at any point in time you are collecting data, the data is collected with respect to a particular location, especially in the context of research, diagnostics, and public health. Which is also, when we decide to look at it from the epidemiology point of view, where most of the time you are looking at people, place, and time, where we are looking at people, place, and time, it's all talking about the data that is collected on people, which largely are biomedical data, subsequently where those data are being collected from. So when you are having an interplay of this data to just understand what is happening, is what we are referring to as digital mapping in that regard, and applying that in the process, applying that using digital technologies to process biomedical data and combining it with their relevant geospatial data is what we describe as digital health mapping. I think over the course of the past 2 to 3 years, we have had, I mean, a really serious, unfortunate global pandemic. And one of the ways that we have seen a lot of discourse happening around that is digital health mapping for us, for countries to truly understand what the true impact of this pandemic is, the COVID-19. We have seen a lot of dashboards being developed to communicate, I mean, the growing numbers of infections across the globe. And to my right, you can see over here by Johns Hopkins Medicine, a dashboard that was developed just to communicate what is happening globally on the prevalence and the incidence of this infection. Again, we have another dashboard which is called the Health Map, which identifies several infectious diseases and tries to communicate what it is also in real time, what is happening, what are the potential health threats and outbreaks in a particular location using geospatial data. And I think all of this largely help to provide some disease on the public health emergency of this, I mean, very serious infectious diseases. I think also we haven't had most of this happening largely because there is a huge disconnect between an understanding of what digital technologies are and how it can be implemented in understanding the epidemiology of certain infectious diseases. And I think the insurgence of the COVID-19 has really brought to bear how we can benefit greatly from generally displaying these forms of data visually. So I would want us to look at what biomedical data is, and I believe most of us are familiar with what it is. The question then is, what kinds of data do we want to classify as biomedical data, and how does that become useful to us in terms of digital mapping? So any data qualified as biomedical data with respect to place, time can be mapped in order to understand its public health impact. I believe the cohort we have been engaging over the course of this training come from a wide area of public health, laboratory diagnostics, microbiology, and you have been making use of quite a lot of data, ranging from patient information data, ranging from the laboratory test results that you have been gathering on a daily basis. All of that constitutes what we call biomedical data. You are free to, at this point, maybe share your thoughts on what are some of the examples of biomedical data, and what, in your perspective, you think is biomedical data. So the chat is open. Feel free to drop in that, and we'll collect that and just make some meaning out of it. This is very important to the work that MicroBis is going to do, because at the heart of what we are doing is data. So very important that you understand that data over the course of several years had informed several decisions across board, most importantly in managing health outcomes, or also generally ensuring that people understand the true degree of infections, if you're speaking to infectious diseases, and how we can overcome them. So data plays a very key role in helping us understand the incidence, prevalence, and generally the distributions of infections, and also informing directions and public health emergencies and solutions mentioned. At this point, I would talk more about MicroBis, because MicroBis is one of the solutions we think would help us address the challenge of antimicrobial resistance. Over the course of several years, again, I mean, many people have alluded to the fact that antimicrobial resistance is contributed by a number of factors, I think most of which have been recounted to you during the course of the presentations. I remember during the just ended presentation on antimicrobial stewardship, we listened to a number of things that can influence antimicrobial resistance, and how generally we can overcome them. And I think one of that is usually we blame it on healthcare providers and the attention or attitude-seeking behavior of, the general public, right? But we at MicroBis decided to take this from a different perspective of the fact that you can have antimicrobial resistance being contributed for by those who are involved in the testing regime or in the business of identifying microorganisms. So that was one of the things that actually informed the development of MicroBis, where we believe that bringing together digital technology and other emerging technologies like artificial intelligence, we put a powerful tool in the hands of a scientist, where they serve as a companion in making the best decision on behalf of the patient. And that is why we describe MicroBis as your laboratory assistant. Now, how does MicroBis work? So basically, MicroBis works by accepting two forms of data, largely two biomedical data, one of which is the biochemical data, and subsequently the antibiogram data. I will take time to, when we get into the demo of MicroBis, just show to you how all of that work. Because we are using MicroBis to help in the identification of bacteria implicated in infection and disease, during the testing regime, or when you are performing an experiment on the bench in the identification of microorganisms, for those of us who do much of bacterial identification, and as alluded, there are several forms by which we can identify microbes. One of which is the gram reaction. The other is that is generally identifying organisms per their phenotypic and morphological appearances. But largely, and if you also want to speciate microorganisms to the species level, you need to go a step further by using the biochemical test and also subsequently using molecular tools. But because of the environment in which we find ourselves, we have most often than not been limited to the use of biochemical tests. So one of the things that MicroBis uses is data from the biochemical tests, together with the antibiogram, the zone diameters of an antimicrobial susceptibility test that you have conducted, to help in your bacterial isolate determination and subsequently determining your antimicrobial susceptibility patterns to this of the bacteria to your organism. So that is one of the things that MicroBis does, using its unique algorithm built upon our AI technology. Again, over the course of time, because data is one of the things that drive digital mapping, data on antimicrobial resistance and subsequently the identified isolates will be gathered. And because of the wide usage of MicroBis, we are going to have data on antimicrobial resistance across several geospatial locations. And this helps to enable us to graphically develop interactive maps that display the incidence and prevalence of antimicrobial resistance in Africa. And we believe that this largely would help paint a broader picture of the actually fragmented system on data and the true impacts of AMR on the continent, because that at the moment doesn't really exist. So I'm just going to do a quick demo of what MicroBis is. Please do let me know if you can see the MicroBis, login screen.
Yeah.
Great. So this is how MicroBis looks. MicroBis is developed with very high security features to ensure that data on patients are very much protected, and not anybody anywhere can just have access to it, because we believe that at the heart of the work we do as people involved in identifying bacteria in the hospitals and also generally in the health sector, data privacy is one of the most important things that we are always supposed to adhere to. So this is built in such a way that without any account, you are unable to log into this platform and to have access to the data that is being generated over the course of time. Now, as described, MicroBis is expected to be your laboratory assistant and not supposed to be the scientist in itself. That is always the temptations. We would have an open discussion about it, where I would be quick to mention that over the course of time, we begin to rely, and these are some of the drawbacks of technologies anytime we are developing them. So I want to be quick to mention that MicroBis, in as much as it has very high predictive power, it is not supposed to replace you as a scientist, but rather enhance your work in the laboratory. So to use MicroBis, you first off need to create an account, and the account creation is done by hitting the Create an Account tab here on the screen. You subsequently would have to provide the following details: the name of your institution, your phone number, the email, where it is being located, the region, and the country. Once all of that is filled, you are automatically going to receive an email telling you the next steps on how you can access the platform in order to use it. Now, because I already have an account on MicroBis, I will just log in and show you how things work from the app. All right. So this is how MicroBis looks like. The first interface when you log in into the app. Now, the procedure for finally identifying bacteria in the lab after a patient sample has been received, I think the first thing is that every laboratory registers this patient. So in MicroBis, we also have that same way of registering the patient. So in order to do that, you will provide the following details as the patient information, the name. So I'm just going to do a test showing you how the platform works. You input the age, the gender, the region. I'm in Greater Accra at the moment. That's my region. Where am I? I'm in Abelempe. So I will just put that in. My contact, the contact of the patient, I'm assuming I'm the patient, and the sample type that is being analyzed in the microbiology lab would be CSF, would be to use CSF. So you are able to key in all of that information. And when you hit save, a unique ID to the patient is generated, and automatically your test moves to pending. Because at the time the patient walks into your laboratory or to the hospital and a clinician requests that a microbiology test be done for that patient, it is only the sample that is taken, and the sample needs to be registered. So you are able to register the sample on MicroBis. Once you register, it will take you maximum or minimum 2 to 3 days for your test results to be ready. Now, once you register the patients by filling in their patient's information details, it moves to the pending portion of the app. In order to access and use the app further in the identification, you need to move to the pending session and click on the test that you have registered. Now, this is where the technology behind MicroBis comes into play. Now, for most microbiology laboratories, we have access to what we call the 8-panel biochemical test, which is a range of biochemical tests that helps in the identification process of your sample, or potentially helping you to pinpoint what is causing an infection. Now, we have largely, during the earlier presentation, the experts spoke about gram-positive, gram-negative, and usually that is always the business of laboratorians whenever they are identifying disease infections. So for particularly bacterial infections. So MicroBis also is able to help identify both gram-positive and gram-negative organisms. To identify gram-negative organisms, we use our range of 8-panel biochemical tests and subsequently our 20-panel biochemical test. Now, the 8-panel biochemical test, from some few minutes from now, you will be seeing what range of biochemical tests you can use to identify bacteria on MicroBis. The 20-panel biochemical test has been built around the analytical profile index, largely called the API, and there are several forms of the API, all of which helps you to speciate the organism that you are looking for. And all of these have high sensitivity and specificity, just to mention. In order to do gram-positive identification, we are calling this panel the staph strep species identification. This largely helps you to identify any gram-positive organism implicated in an infection. I'm going to demo how you can use the 8-panel, the staph strep panels of MicroBis to identify an organism. So I'll start off using the staph strep species identification panel. Now, very key features you will see on MicroBis as a registered user is that you will be seeing the test ID of the patient you are working on, the date and time at which you registered the patient, and subsequently the name of the laboratory scientist that is conducting this experiment. This helps us to gather information, especially in your unique environment, to know at which point in time who is working on what. Now, you had seen that we had created a patient, we had registered the patient's test 8 with this patient information, and subsequently we are trying to identify a gram-positive organism for which we are using this range of biochemical tests. So the range of biochemical tests available for the identification of a gram-positive under the heading staph strep species is coagulase. We have catalase, we have beta hemolysis, we have alpha hemolysis, we have gamma, we have optochin, we have bacitracin, and growth in saline. These are the wide range of biochemical panels or tests that you can use in the identification of a gram-positive organism on microbis.io. And as scientists, anytime we perform this test, we have access to either determine whether the test is positive or negative. And it's exactly the same thing you need to do here. So I'm just going to use a hypothetical result to determine and show you how MicroBis uses its unique AI algorithms to identify an organism. So assuming I perform the test and then coagulase is positive, I select the positive, catalase say positive, hemolysis positive, alpha beta hemolysis is positive, beta hemolysis is positive, gamma negative, optochin positive. These are just hypothetical tests. I'm not having access to any clinical results. So just bear with me. This is just to demonstrate to you how MicroBis works. Let's assume bacitracin is also positive and growth in saline is positive. Now, we have two main portions for all the tests that you can conduct on MicroBis. I mentioned to you earlier about the unique feature of what MicroBis is able to do, that MicroBis accepts two forms of data. It accepts the biochemical test data for both gram-positive and gram-negative bacterial identification, and subsequently, it also accepts in the form of numerical data results of the zone diameters of the antibiogram test you have done as part of your antimicrobial susceptibility testing. So we have available at the moment a range of 8 different antibiotics. I know that not every lab may be using this currently, so that the platform is still open in such a way that without having to fill in any of this, if you haven't conducted that, you still can use MicroBis to generate an isolate. So I'm just going to put in hypothetical zone diameters for 3 or 4 of these antibiotics, and we see what the result looks like. So from the first, so this is, so in order to use the platform to generate an isolate, we click get results, and the platform then uses the unique algorithm to generate the isolate, which is the identified bacteria, which is Staphylococcus aureus, and it also gives you the culture and sensitivity reports. You have what it takes to then download this as a PDF, which is downloaded here, which I can show when I stop sharing the screen. I don't know if you can see that. If you can see,
yes.
You can see the PDF.
Yep.
Can you see the downloaded PDF?
Yeah, we can, yeah.
Yes, Harry, we can see.
Okay, perfect. So you are able to download this, and this we believe can be sent to a clinician to understand and then take on the treatment protocol from there. You can equally just hit OK, and the results is updated into the history panel. So all that we were doing was happening in the Home tab. So the Home tab allows you to register patient and subsequently follow up on pending cases, which you then update with the results moving forward. Now, interesting to how MicroBis works is that MicroBis is serving as a data repository where all the tests that you are conducting, you are collecting that data over time, and the data is key, especially to helping provide information on the true incidence and prevalence of resistance bacteria, just general isolates within your facilities. And that is the power, because we believe that over the course of time, data in understanding the impact of AMR has been very much fragmented, and one of the value propositions of MicroBis.io is that it helps you to create this data within your facilities to inform subsequent decision making. All patients that have been used or registered within the platform are equally documented here for your viewing. Now, there are certain features which helps you to quickly navigate through the platform. You are able to search patients. So let's assume you want to search patient 9. You can just search, it pops up, and you can work with this. You can subsequently export this data as a PDF. So this is downloaded. You can export, and you can then work with that data. So I'm just opening that for us to see the data that has been collected. And so these are some quick features of MicroBis that you can use in first of all, maybe getting some basic insights by performing some basic statistics on the data that is accumulated over the course of time. Once you create an account on MicroBis, you have you can move to the settings section where the person who creates an account becomes an admin, and you have the opportunity or the ability to add not more than 3 other people who then can use the platform with you as your team. Because most often than not, in most microbiology lab, you are working with a bigger team, and people also can have the opportunity to advance the work that you are doing over there. So you have the team setting where the admin has the ability to add these people once a person logs or create an account on MicroBis. You are also able to see the team, the institution setting. Equally, you are able to edit and make some changes from there also. So in short, this is how MicroBis works. We tried as much as possible to build a tool that is that simple, flexible to work with, and can provide you with really great user experience, and also helping you to generally speed up and assist your work of bacterial identification. So basically, this is how MicroBis works. I would pause here. I mentioned that I will just go on to the slides presentation, and we continue from there. Now, we have moved into the time to do our datathon, and these are a set of instructions that would help us to quickly do that. So in order for you to participate in the datathon, I would appreciate if you can type in your full name, your email, your contact into the Zoom chat. And then I'll add you on as a team. I may not be able to do that for almost everybody because of how it works. And also currently, you can create an account on MicroBis, but it will take us roughly about 6 to 12 hours to give you access to the platform. because we are still developing it, but just for a quick demo to at least the first 2-3 people who are interested, just to demonstrate what MicroBis, the power of MicroBis, we would appreciate that if you could send in your login details as mentioned above. And then what the task would be is that you identify 10 isolates using microbis.io. I believe you have access to some data from your end. So, sorry, you can then, sorry. You can use that to identify some isolates and subsequently export the data, which will come in as an Excel file format, perform some basic statistics on the data, showing some graphs, and then send the results into the chat again. Or you can also personally just send me those on ariakligo@microbis.io. So that will be about the data ton. I'll just quickly move through the rest of the slides so we can save some more time later on for you to do that. Now, I'll just also do and show you a quick demo on the dashboard, which is one of the most important aspects of MicroBis in communicating the true impact of antimicrobial resistance. Sorry. Can you see my screen?
Yeah, we can.
Do you see the public dashboard, please?
Yeah, we see the public dashboard, and then we're starting to see the map, but scroll halfway. Yeah.
Do you see everything now?
Yeah.
Okay, perfect. So this is the dashboard for microbis.io. In order to access this, you go to www.microbis.io/public in order to access this.
Okay.
It is still a work in progress because key to having a very interactive map and understanding the true incidence on the impact of antimicrobial resistance is data. And like I mentioned, the data around antimicrobial resistance is still fragmented, and we are hoping to use MicroBis to create that data repository on antimicrobial resistance and subsequently communicating the impact of that. However, the platform has very important features that helps you to just understand what is happening in a country level perspective. So for now, since the project is happening in Ghana and Tanzania, you have what it takes. We are expecting that we would have a lot of contribution and usage from across Africa. And I know we have quite a diverse participation on the AMR MOOC so far. So we are hoping that data that is collected across the various nations in Africa would be automatically populated on the dashboard. So we are able to search through and see what is happening across the various nations in Africa. And subsequently, you are also able to search, perform more refined searches on the platform to see what is happening within a particular geography or location within a particular country. So that is one of the things you can do just from a short point of view. You also are able to see what over time the growing number of identified resistant bacteria within your population. So over there, if you also want to see what the changing or growing number of the resistant bacteria that exists within a particular country on a monthly basis, you are able to see that this data is accumulated over the course of time, which you can see. So these are tabs from which you can filter. You can filter from a country level filtration. You can also do a regional or region level filtration within the country, and also you can see what is happening on a yearly basis. So that is to give you a trend-based analysis on the growing numbers of resistant bacteria. Again, we are also able to see over the course of time what is the growing number of antibiotics that are showing resistance, or antibiotics that have resistance to identified bacteria over the course of time. And this, we believe, at the end of the day, will provide insights on to people who are at the public health emergency and intervention points to understand how these can be used in forming policies around overcoming the challenge of antimicrobial resistance, which is a huge burden moving forward. I think this is largely the end of my presentation. We are moving into the next session, which is supposed to be an open discussion. And this is the question to drive that. I would pause to have any questions, and then we can move into this. Thank you.
I think Linda has a question.
Okay.
Yes, Harry, thank you very much. It was a very good presentation. I hope you can hear me, right?
Yes, I can. Yes, I can hear you.
Yes, Harry, it was a very good presentation, and myself, I've enjoyed it. And I had like some questions,
Okay.
and maybe concerns is about the data analysis of what is entered in the program. Is the program capable of giving like if you ask for certain statistical figures, maybe if you want, I saw a chart already, like a graph, but I wanted to know if you can perform other tests and see maybe if there is a significant difference between two regions or two locations or maybe two countries. That is one. And the other one is who will be allowed to access the data from the program. Is anybody allowed to see what is happening within a region or within a certain country, or it's restricted to a certain number of people or a certain group of people? But also my other one was in the first, when you enter the first column of saying whether it is catalase positive, for example, or negative. My worry is on that part of decision. If someone is doing the work, it could be easier if we enter the color you see, and it's the program which says whether it is positive or negative, because you can enter that it is positive while it is not, depending on what you see or what you know. So I was having a query on that.
Okay.
Thank you.
Thank you. So the first part about performing some advanced statistical analysis on the data that is visualized on the public dashboard. For now, we do not have what it takes to compare and determine statistical significance. We believe that is a more advanced form of statistics. However, we believe that over the course of time, when data is accumulated, those are some of the features we want to include on the dashboard to provide some level of direct resource for people who generally are interested in the data around AMR to make decisions. But for now, it is just serving as a platform that is visualizing and determine what the impact is in terms of whether there's a growing number of resistant strains or there's a growing number of antibiotics that are showing resistance to a common group of bacteria, and how can people begin to look at that to inform behavioral change, and just to mention but a few. So that is what the state of the dashboard is like currently. Moving to the question on whether or not you can access any data from the dashboard. No, the data, you cannot access any data from the public dashboard because it is only serving as a visualization platform to show the incidence and prevalence and the growing numbers of these two important parameters that are involved in antimicrobial resistance. You cannot download any data. The data are largely owned by this group of people who are using MicroBis as identification laboratory assistants. So that is what it means. You cannot own anybody's data. Who are developers of this platform also do not own it. And for that reason, we have put in structures that the data is entirely owned by the people who contribute to it. We believe that if people and who are generally at the policy-making point of view, scientists who are contributing to this data have access to what is happening elsewhere, or even just truly understanding what is happening within their facilities, it helps them to put in structures. So that is what it is with regards to data privacy and protection from our perspective. We are working very hard to make sure that we keep that, and thanks to funding that has come through the projects we are working on, and we believe that this is just the beginning to making that really secure. The point about using color. So one of the things that we have come to realize, again, for other similar solutions that are using digital technologies and AI, is that there is this whole conversation about garbage in, garbage out. And that is one of the things that how AI works, where it works, or it's a data-driven tool or technology. So whatever data you put in there, you should be expecting that it is going to subsequently give you what you are intending, or the data is supposed to return to you. So that is why I mentioned from the beginning that MicroBis.io is not supposed to be a superpower, but it is supposed to enhance or guide you in the process of decision making as a scientist who is identifying microbes on the bench. We want to reduce human-centered error that comes with identification. And for that reason, in the development of our AI platform, we simulated the algorithm with data that is near to some high number of statistical power to enable you to do the identification. So when you are a scientist who is working on the bench, and that points me to one question in the Q&A that is saying that a platform had identified something and they were suspecting something, right? That is the point where we are expecting that you and the platform come together to make a decision in the best interest of the client. So that is where it's supposed to be, but you are not supposed to rely on MicroBis entirely for doing that work for you. Otherwise, MicroBis will become too powerful than you. And that is not what we want to do. And that is not what we expect MicroBis to do, but rather augment you and enhance your processes of doing that. So that if something ordinarily you would not see, MicroBis helps you to see, and then you question it. So that is the answer I would want to proffer to your questions, and so but I'm happy to answer any other questions that may come up.
I think Rita had a question. If like she should be able to talk.
Hi, Rita, please go for it.
Okay, hello. So good. I don't know. So I'm from Ghana. So good afternoon. Good morning, I will say. Yeah, my question on the MicroBis that you talked about. From what I'm getting, is basically towards those who are more on the bench and doing their daily routine work. I want to find out how many facilities have you kind of saw this idea to, and if probably in Ghana, the ministry has been approached on this, because sometimes people would use some of these tools when they are available and there's not some form of authority pointing people to do that. It will be there and it will not really be used. That's why I'm asking. And my second question, is it solely for those who are working on the bench? Because from the data you need to put in there, you're putting information on patient's ID and all that. I'm asking this because I am currently working on Klebsiella species, and I'm taking samples from different facilities in Ghana at different regions, just to look at the prevalence, the resistant patterns across the countries, the clonality and all that. So with a project like mine, if I find something interesting, how do I feed into the MicroBis? Thank you.
Thank you, Rita, for that question. So MicroBis was developed not only for use in clinical microbiology, but also can be used for also environmental-based microbiology, and also generally people who are in the business of doing research around a particular identified strain. I mean, over the course of time, I mean, even if you take a sample, which in your case, you are working on a said bacteria, you still can use MicroBis to serve as your data repository on and subsequently identification. Now, that is one way to which you can use it. Most importantly, one of the things that we have realized during our, market research during the course of just understanding a market for MicroBis is that in most research facilities, they are open to using the analytical profile index. And in my presentation, I mentioned that we equally built MicroBis around the analytical profile index, where even when you are strictly in research, you still can use MicroBis not only for identifying bacteria, but also helping you to, create data on your entire research process. We haven't figured out everything with regards to that. It is still a platform we are developing, and we are developing it for you and by you. So we are open to have you contribute to the development of MicroBis, and that is why on Joggle, where we are hosting the project, we are creating a whole community around that. So it is open for you to share ideas, what do you think we can do to enhance its use. Right now, we are building a strong use case around the use of MicroBis in clinics, because we believe that over there, they do not have access to a wide range of biochemical tests because of issues, one of which may be funding, preventing them from getting the required consumables. So for most of them, I mean, maybe you can and others on the course can attest that have access to quite a wide range of antibiotics, also biochemical tests and antibiotics. So we try as much as possible to start off from there, because that is where the real use case of even starting the research stems from. So for now, that is how we are solving the problem. But like I said, it's MicroBis is open to you. You are going to be at the center of its development so that you make the most out of it. Now, the last part on have we approached any facilities? Have we had any local authority backing on this? Yes. MicroBis, of course, is in its earlier stages of development. We are still testing how it can be used. Later down the line, all of that will be taken care of. We anticipate and hope that it becomes a household tool in microbiology diagnostics in Ghana and elsewhere and on the continent. So that is what I would say to that. We have a few people testing it. I don't think it is right of me to mention names of facilities that are testing it, but we have people that are testing it, and I'm grateful to them for their feedbacks that are giving us so far. Without them, we wouldn't have gotten this far. So that will be my response to your question. Thank you.
One thing I was wondering is when do you think the register link will be available so anyone can join up?
Pardon?
When do you think the register link will be available so anyone can sign up and join MicroBis?
As it stands now, it is available. My team, who are largely responsible for the technical software part of things, will need to. So once you register, MicroBis is working right now, you can go create an account, and I mean, you should within the next 6 to 12 hours start seeing email feedbacks from us on how to start using it and testing it and giving us feedback. Once you do, the email feedback gives you ways on how you can access the platform, and subsequently communicating back to us with what you think should be improved, and then we build it for you. So
actually, yeah, you're right. I found the login where you can register. It looks like anyway. Yeah. Okay. Cool.
I see a lot of contributions. Sorry, I'm not able to see what is happening in the chat. I see.
Oh, I see. Yeah.
Yeah.
I just put that in the chat anyway if anyone wants to sign up.
Yeah.
It looks very, very impressive. There was one question I saw, which I thought was very interesting in the Q&A, is anonymous attendee was maybe they've already started using MicroBis, and they personally found the isolate to be one strain, but the app found it to be another. But I assume they're using the same decision trees to sort of decide the isolate that they're talking about. So what would you do if you personally found or thought it was one strain and the app thought it was another?
Okay, so in my case, I mean, when I'm using it, I think I had quickly responded to this question, but just to reiterate, MicroBis is not expected to become powerful than you as a scientist. The first thing you should, as a scientist, when you are working in the lab and you are identifying bacteria, you are suspecting something. All you are doing is to confirm it. So if your confirmation doesn't tally with what you are expecting, there is a number of degree chances that you want to go back and reassess things. But for us, that is why MicroBis is coming in. You have available a wide range of tools in doing that. Even before you get there, the traditional system is using a chat-based document to help you to do that, right? Even in the process of using that, people still have this kind of discrepancies because they are anticipating a particular behavior to the of the organism to the test that they have subjected it to. However, it doesn't come out as it is. It is exactly the same thing that is happening with MicroBis, and that is why I mentioned that you are more powerful than. You are not more powerful than MicroBis, and MicroBis is not more powerful than you, but together you are powerful as people who are trying to understand and pinpoint. So this shouldn't be left on either you, the traditional based system, which we believe that has a higher error-prone system, and also not only to MicroBis, but the two of you coming together, or the two systems coming together to actually use some level of critical decision making with other factors to make a clinical decision that this is the isolate we think is responsible for the infection. Of course, if you a particular data that you are entering is giving you maybe different biochemical test data you are entering as input into MicroBis is generating the same isolate. Obviously, that is something you need to report back to us, but we are saying that don't make MicroBis become overly too powerful than you, but it is rather supposed to augment your work and make it easier for you, and also help you to see things ordinarily you may not see. So that's what I want to say.
I'm just going to let Precious talk. There's a question.
Yeah, hello.
Yes, we have some questions in Q&A.
May I come in, please?
Yep.
Yes, please.
Yes, please.
Yes. I was asking if I realized that during the entry into the MicroBis for a patient who comes in to run a microbiology test, it appears, I'm not sure, but it appears that one sample is selected per patient, and then after that, when everything is being inputted, a specific ID is generated for the patient. I'd like to find out, is the system able to capture more than one?
Sorry, we can hear you, Precious.
I think I heard what he said. I think he was asking if, although unsure, if the system is able to capture more than one sample per patient.
Yes. So it's able to capture more than one samples per patient, and you are able to see the various isolates you are generating for those patients are. Yeah, so we have optimized MicroBis to do that, so that if a patient is reporting at different times with different clinical samples for microbiology tests, you are still able to have all of that done.
And then there was someone else who was asking, I think Hamisi was asking, is MicroBis, or will it be able to process if a sample isn't from a patient, but rather from the environment?
So there is no strict rule to saying that the sample of interest that is being analyzed is coming from an environmental sample or not. It starts from the bench. It starts from whoever is conducting the experiment. So MicroBis wouldn't be the one telling you that the sample is from environmental source or is from clinical source. However, what MicroBis is able to do is that MicroBis has been optimized not only to identify pathogens or bacteria from clinical source, but also from environmental source.
Okay. Well, I think that's all the questions, but thank you. And I'm probably going to start using MicroBis actually, because it would be very useful to keep and store data in. And it'll be interesting when the map is available to see, like, the map of resistance, not just in Ghana and Uganda and Tanzania, but perhaps elsewhere as well. Thanks.
Thank you.
I thought now was a good opportunity, as there are quite a few people still here, to talk about some things that are going to happen next as well. So within the program, we've just now finished the 5th MOOC, as you know, about MicroBis, and we have great ambitions as well. So we've got a €1,000 grant which is available as well, and I might share my screen if it's sensible. Yeah. So I'm going to share an email later today with everyone, and then on Google, and share it as much as possible, that we are about to start a grant round in AMR. So we've done grant rounds before on COVID-19, but from next week officially, when we do a sort of guidance on how to build a good project and how to build a good proposal, we'll be opening officially, but you can already start submitting projects to Jogel in hopes of getting the grant. And so how this works is, effectively, all applicants are reviewers. So it's not us who will be deciding, but instead everyone who is applying will also be required to review other people's projects. And then the person who gets, in this case, the highest score, will be given funding to do the little project. Unfortunately, it's only €1,000 this time, but we're hoping to do more later on, especially in subsequent programs. So yeah, if you do have an interesting idea, so if it's about AMR stewardship, or maybe you want to conduct or lead sort of a data collection, maybe for MicroBis or maybe for something else, to learn more about AMR, maybe you've got a research project, maybe you've got a an AMR awareness project. That would be quite awesome. So it'll be open for quite a few weeks, and you'll know when any deadlines approach. But yes, so on the Jurgle program, which is, I'll just put a link in the chat later, but at the Jurgle Challenge AMR Africa Grants, so it's within the Africa Against AMR space. I'll send an email later. There's a sort of guidelines on how to build your template and build your grant proposal. And what I suggest you do is, I suggest maybe on the AMR space, you say, hey, look, I want to make a project. Would anyone like to make a project with me? And also we'll be having a workshop next week where we can start to form teams, yeah, so that would be quite interesting if anyone's interested in applying for a grant. Yeah, and that'll be decided by yourselves. And then we also have the MicroBis and data collection. That'd be really interesting. And then throughout this series, we've been talking about certificate, and later today, I'll send an email on anyone who's missed a lecture, if they can fill a form with questions about what the lecture is about and some key elements to prove that they have watched it. Then in the end, we'll send all certificates to say that you've attended and that you complete the module. And then we've also got a feedback form as well. So again, we've created a feedback form for the module. So if you have any ideas or feedback for this particular module, especially as this is sort of our first educational module that we've done with Jurgle especially, we plan on doing more. We think it's kind of a good idea in sort of getting people together in one place, talking about things, identifying problems, and then when we come to do a grant, so we're doing a grant this time, and we're hoping to do further rounds like this with more money, greater ambition. So any feedback will be used for creation of new programs. So please think anything you can think of would be great. More opportunities coming. So yeah. Would anyone else like to say anything from the team? Okay, so I'll just, maybe you can share the form again. I think that's it.
Chris?
Oh yeah, okay.
Yes, I just want to insist for those who are coming from Tanzania who would like to join from the practical session that will be taken at Mbeya University of Science and Technology. The dates will be communicated later, but I would like them to email to me. My email will be shared in the chat, and let me know if they would like to attend the training. But they should keep in mind that there will be no funding for that, so they will be responsible for maybe for the transport, accommodation. But for those who are residing in there, they are mostly welcome to join for the practice.
Just to follow up on that also, we will be holding a similar training in Kumasi. So for those who are on the call and interested in learning how to do bacterial identification, also using the API alongside MicroBis, you are also invited to reach out to me. You can actually do that via the email I have shared, or maybe also through Jurgle. And I think a number of you also have expressed interest during the application process. So reach out to me. We also are planning for that. And we would love to welcome you and make the most out of this. We already are building a community around that. So please feel free, for those who haven't joined, especially for the individual MOOCs, please do join, because a lot of engagement will be happening from there. Those who are interested in MicroBis and we want to see it come to stay and makes a great impact, please reach out to me. We are developing it together. So please reach out to me and don't hesitate to share any feedbacks to enable us improve it. Thank you.
Well, okay. Thanks everyone. Well, I guess next week we'll be doing a workshop. We'll announce that later for anyone who's interested in applying for grants. But this is the end of the AMR MOOC online, and then we'll be doing practical sessions that we'll email about later with Harry and Linda.
Yeah, and I'm sure we'll be taking the last family photo for.
Yeah, that would be brilliant.
Yeah,
of course.
Just for the MOOC.
I'll put everyone to panelists. So it could be that some people aren't interested in the grants, or we don't see in real life. So I'm going to put everyone in the chat to a panelist, and they should all be allowed to speak. So also feel free to speak, talk about anything you're interested in. It'd be nice to speak your mind. Some people don't want to be a panelist.
If you can also quickly turn on your videos, that would help, just so we can do this quickly.
It's been a real pleasure. Some of your emails have been really lovely. I hope that we talk and in some cases collaborate in the future, especially with the grants that are coming up. And see you next week if you're interested in that. I think Rita, if you're there, your mention of your study on various different bacteria and all that data could be really useful for MicroBis and building insights. The reason we're building MicroBis is to to change policy lives. So.
Hello.
Hey.
Hi.
Hello. I am.
Chris, are you taking a picture?
No, I haven't yet.
When I click on
I think Gamli's better at doing that.
I'm not sure.
That I need the permission from you.
To share screens. Oh, you can't.
Can you please turn on your video so we can do a quick picture, please?
Yeah, wait. I'm not saying. Turn on my video. Okay.
Okay, Chris, maybe we can.
Okay. Yeah, we should go for it now. I think everyone's been asked.
I think we are done,
Yeah.
right?
Yeah, we're done. So thanks everyone.
Thanks everyone. Bye.
It was lovely to see you, and see you again soon. Bye.